Hey everyone, this is Mike. Welcome back. And today we're going to talk about how a Jungian would treat OCD. We did ADHD last time, so let's try it now for OCD this time. So, a Jungian or analytical psychologist, or psychological analyst, would approach obsessive-compulsive disorder, OCD, different from a Freudian analyst, though both share a focus on the unconscious. While Freud emphasizes early childhood conflicts and repressed impulses, Jung's perspective expands to include the collective unconscious, archetypes, and the process of individuation. Here's how a Jungian analyst might treat OCD. So core Jungian concepts applied to OCD. Individuation. Jung saw OCD as a manifestation of a blocked or thwarted urge towards individuation, the innate human drive to become a whole, unique, and integrated self. When this natural drive to develop one's psychological potential is suppressed or diverted, it can lead to neurotic and compulsive behaviors. The compulsions become a substitute for living out one's authentic self. The shadow. Obsessive thoughts and compulsive behaviors might represent aspects of the shadow, the unconscious, disowned, and often dark or unacceptable parts of the personality. The individual might be unconsciously projecting these disowned qualities onto the world, leading to fears of contamination, harm, or impurity, which then manifests as obsessions. Compulsions could be attempts to control or deny these shadow aspects. Archetypes. While not directly stating that specific archetypes cause OCD, a Jungian analyst might explore how certain archetypal energies are out of balance or being expressed in a distorted way. For example, the puer puella aeternus, the eternal child archetype, might manifest as a reluctance to fully embrace adult responsibility, leading to a need for control and perfection in small ritualistic ways. Or the hero archetype, if misdirected, could lead to compulsive battles against internal perceived threats. The trickster archetype, associated with chaos and disruption, might be at play in the unpredictable and nonsensical nature of some obsessions. Symbolism. Jungian analysts place a strong emphasis on symbolic meaning of symptoms. The analyst would look beyond the literal content of the obsessions and compulsions to understand what they symbolize about the patient's inner world and their relationship to the unconscious. For example, excessive washing might symbolize a need for a psychological purification or a cleansing of guilt. Connunciation or union of opposites. So OCD can be seen as a struggle with opposites, the conscious desire for order and control battling with unconscious chaos or impulses. The goal would be to integrate these opposing forces rather than suppressing one in favor of the other. So treatment approach. A Jungian analyst would utilize techniques aimed at exploring the unconscious and promoting individuation. Dream analysis. Dreams are highly significant in Jungian analysis. The analyst would work with the patient to interpret the symbols, figures, and narratives in their dreams, as these are seen as messages from the unconscious that can reveal the underlying dynamics of the OCD. Active imagination. This technique involves consciously engaging with unconscious material, images, feelings, thoughts. Through creative means like drawing, writing, or visualizing, it allows the patient to interact with the forces that are driving their compulsions and gain new insight. Symbolic amplification. The analyst might explore the historical, mythological, and cultural parallels to the patient's symptoms, enriching the symbolic understanding of their experience. Exploring the persona and shadow. The analyst would help the patient understand how their persona, the social mask they present to the world, might be contributing to the repression of aspects of their shadow, which then manifests as OCD symptoms. Transference and countertransference. Similar to Freudian analysis, the analyst would pay attention to the dynamic between themselves and the patient, as it often reflects unresolved relationship patterns and unconscious processes. And then emphasis on wholeness. The ultimate aim is to move beyond mere symptom reduction to a more profound process of psychological integration and self-realization, or individuation. This means helping the individual understand why they are experiencing these compulsions in the context of their unique life journey and the archetype patterns at play. Distinctions from Freudian treatment. Broader unconscious. Jung goes beyond the personal unconscious, Freud's primary force, to include the collective unconscious and archetypes. Focus on future potential. While acknowledging the past, Jungian analysis often looks at the present symptoms as pointing towards the future psychological development and the unlived life. Less emphasis on pathologizing. Symptoms are often viewed as a meaningful communication from the psyche, rather than purely as pathological formations. And more creative engagement. Jungian therapy incorporates more creative and symbolic techniques beyond just verbal association. So effectiveness and practicality. Like classical Freudian psychoanalysis, Jungian analysis for OCD is a long-term and in-depth process. It is not typically the first line of intervention or treatment for OCD, as evidence-based therapies like CBT and ERP have demonstrated greater efficacy in symptom reduction. However, for individuals seeking a deeper meaning, more existential understanding of their suffering, and a path toward greater psychological wholeness, a Jungian approach might be considered often as a complementary therapy or for those who have not found success with other modalities. I apologize for any mispronunciations to some of these words. I'm not a Jungian, but I hope this was helpful and you learned something from it. Let me know in the comments, and I look forward to seeing you next time. Take care.